the Dermatology Associates and Surgery Center.
And welcome to today's edition of Ask the Expert. I'm Shea Paul, and I am here in the studio with my friend Jennifer Whaley, nurse practitioner of Dermatology Associates and Surgery Center. It's a lot of words, Jennifer.
Yeah.
It's great having you with us.
Thank
We've
you.
known each other for a long time, and it's good to have you on our show today.
it's good to see you.
I know that at Dermatology Associates, you treat a variety of skin conditions.
Sure.
And we're going to focus these next 3 weeks, we're going to focus on skin cancer, which is a very common problem. And we're going to kind of go through the stages and talk about some of the conditions that you might see that are leading up to skin cancer. So today it's going to be actinic keratosis. Did I say that correctly?
Yes, that's correct.
Okay. So what exactly is actinic keratosis, and can you tell us what it looks like?
Yeah, sure. So actinic keratoses, those are precancers that, if left alone, will turn into a squamous cell skin cancer over time.
Okay.
So these often pop up on sun-exposed areas. We often see them from the head up. We see them on the extremities. And it's just from overall sun exposure. So actinic keratoses, they can present as a flat, rough type of lesion. Patients will often report a sandpaper feel on the brim of the ear, perhaps on the face, the extremities. But those places, if left alone, they can progress into a squamous cell skin cancer.
Okay. So you mentioned that you see these often in sun-exposed areas.
Sure.
I know sometimes they say even when you're driving, you know, that sometimes the side of your body that gets the most sun, if you're a driver, you're going to see things like that there more often.
I actually have a patient, he's a bus driver, and this arm in particular, you know, where it's had years of sun exposure.
So even in the car, you should be wearing a sunscreen, basically.
Protecting our face, our ears, our neck, our hands, any area that's exposed to the sun.
Okay. Now, once someone has displayed symptoms of actinic keratosis, how do you typically treat it there?
Yeah, so usually that's a clinical diagnosis. We can look at the skin and most often diagnose it from just looking at it. With these actinic keratoses, we can treat those with topical modalities. We can also do photodynamic therapy and freezing with liquid nitrogen. So it's fairly easy, done there in the office.
Okay, so let's say someone waits. What would be the protocol if they've waited too long? Is it going to necessarily always turn into a form of skin cancer?
If given enough time, yes, it will.
All right, so it's very important.
It will get rougher, thicker, larger. And so eventually you will notice something there on the skin that needs addressed.
Okay, so the point being, you don't want to wait. If you see something like this, why would you not?
Yeah, these little precancer actinic keratoses, they are very treatable.
Okay, very good. So I know that Dermatology Associates has several locations.
Sure.
You are in the Charleston?
I'm in the Charleston location on Mondays and Fridays, and then I'm also in the Logan office on Wednesday.
Okay, and then the other locations, just to run them down for our audience, because I know they are everywhere.
Yeah, there's one in Taze Valley, there's a Princeton location, Beckley, and even Hagerstown.
Okay, very good. So no excuses not to come and see you, right?
Yes,
okay. Jennifer, thanks so much for being with us today. It's excellent information. We're going to continue this discussion next week and the following, talking about the two forms of skin cancer that this could evolve into if not treated.